Hello and welcome to the World Today on Channels Television. Thank you so much for watching. Now we begin concerning health matters. U.S. health officials have confirmed the first patient infected with the deadly Ebola virus disease and that he's been diagnosed after flying from Liberia to Texas. It has also been confirmed that the patient sought treatment 6 days after arriving in Texas on September the 20th. He was then admitted 2 days later to an isolation room at Texas Health Presbyterian Hospital in Dallas.
It's the evening rush hour here in Washington, D.C. Many are going home at the end of their shifts. They're either taking buses or they're taking taxis, they're driving in cars or they're walking. Either way, they're either spreading or receiving germs. This is a hand sanitizer. It's become a common staple for us in West Africa. Doctors say using a hand sanitizer prevents the Ebola virus disease from spreading. America's just discovered its first case of the Ebola virus disease in Texas. How are people reacting to that news?
The Center for Disease Control has assured that this is the first case of Ebola.
Traveling from Liberia has been diagnosed with Ebola in the United States. This individual left Liberia on the 19th of September, arrived in the U.S. on the 20th of September, had no symptoms when departing Liberia or entering this country, but 4 or 5 days later, around the 24th of September, began to develop symptoms. On the 26th of September, initially sought care, and Sunday, the 28th of September, was admitted to a hospital in Texas and placed on isolation. We received in our laboratory today specimens from the individual, tested them, and they tested positive for Ebola. It does not appear that the individual was involved in the response to Ebola, but that's something that we will investigate more. In terms of the airline flight, I really do want to emphasize the focus here over the next period needs to be the patient, and we're very focused on trying to get any assistance we can to the patient who we understand is critically ill at this point. And then identifying contacts in the community, family members or others, and then any possible contacts through the healthcare setting, and then tracing those contacts. In terms of the flight, I understand that people are curious about that and wonder about it, but remember, Ebola doesn't spread before someone gets sick, and he didn't get sick till 4 days after he got off the airplane.
Now, Foreign Affairs correspondent Amarachi Ubani has been speaking to some Americans concerning their reaction to this news of a first case of Ebola virus in the United States, and here's what they had to say.
It's the evening rush hour here in Washington, D.C. Many are going home at the end of their shifts. They're either taking buses or they're taking taxis, they're driving in cars or they're walking. Either way, they're either spreading or receiving germs. This is a hand sanitizer. It's become a common staple for us in West Africa. Doctors say using a hand sanitizer prevents the Ebola virus disease from spreading. America's just discovered its first case of the Ebola virus disease in Texas. How are people reacting to that news?
The Center for Disease Control has assured that this is the first case of Ebola diagnosed in the United States and the first case of this strain of Ebola diagnosed outside of Africa. Texas, where the case has been identified, is almost 22 hours from the U.S. capital, Washington, D.C. And the reactions here are mixed on hearing the news.
It's very scary. It's very scary because it can spread all over.
So even I heard like skin contact, I think just education to get people educated about it, I think is the only thing we can do right now.
And one of the most common things you find any Nigerian has in her purse is a hand sanitizer.
Mm-hmm.
You have one.
I do have several in my house. I actually just switched bags, so I don't have one with me right now, but I do have them.
For those who are not aware, there's no immediate danger. Local healthcare providers such as pharmacists like these refusing to speak on camera, so they've received no concerns from the CDC concerning its spreading. Not all Americans, though, live in the illusion that this could be an isolated incident. Winston Taylor is a Nigerian who's lived more than 20 years in the United States. He urges more awareness of the disease, especially among the African community in the U.S.
We as an African state, different countries in Africa, they just ignore the idea that it's Ebola. There's, oh, well, we don't have it in our own country, it's just in the West Africa. No, this is African problem. It's not just West Africa, it's not North Africa, it's the African problem.
But he also wants the U.S. government to spend less on the campaigns against ISIS in Iraq and in Syria, and instead direct resources towards helping African countries battling with the disease.
It may be just one case of the Ebola virus disease in the United States, but it's one case that could prove worrisome if people are not aware of the presence of the Ebola virus disease in the country. However, people depend on the government to do something to curb it. Here in Washington, D.C., I am Amarachi Ubani, reporting for Channels Television News.
Now we're now being joined live via telephone by a correspondent who you just saw in that package, Amarachi Ubani. She's going to be talking to us and giving us an update concerning the Ebola virus disease in America from Washington. Amarachi, it's lovely to have you on the program. Thank you so much for joining us.
Hi, Sam.
Okay, so can you just give us an update for today? After speaking to people yesterday, what have you heard now?
Well, no one's really talking about it anymore. People are actually carrying on with their normal daily life, normal routines. Even the Center for Disease Control said it's still carrying out tests to confirm that he really has Ebola, and they're trying to trace how many contacts he may have had since arriving in the U.S. He was discovered, he did arrive in the U.S. on September 19th, but he wasn't ill at the time he arrived. But he fell ill, I think shortly after his arrival, then he went to hospital, discharged 2 days later, and it was maybe one, he fell sick again and then was brought back, then was diagnosed as having the Ebola virus on September 24th. And so they're trying now to trace the number of contacts that he's had and bring them into quarantine. So far, here in Washington, D.C., nobody really is particularly perturbed about the story, about the incident. People are looking more to the government to do everything. That's what I discovered. A lot of people believe that the U.S. government has enough, resources, a plan on ground, to handle the Ebola virus disease. They're scared, though, of it spreading. They're hoping that they find all the contacts that the young man who's still unnamed has had here in the U.S.
So basically, from what you're saying, there isn't really a cause for alarm then. And I also heard you just say now that they're trying to confirm that he actually has the Ebola virus disease. So is there a possibility that this might actually be something else and there might not be any reason to worry at all?
Considering the fact that the man was coming all the way from Liberia, it is very likely it is the Ebola virus disease. They put in the hospital in Texas, the Presbyterian Health Center, I think in Texas. But there is no cause for alarm yet because it's just one case. If another case is discovered from those who are being put in quarantine, those who are in isolation, who will be tested over the next few days, then there will be cause for alarm. But apart from that, there really hasn't been any issues concerning that. Specifically, some of the pharmacies I went to here in Washington, D.C. are like, they're not aware, they haven't received any alerts, from the CDC. They think that they're handling everything else. I think there's really no cause to worry just yet.
Margie, thank you so much for joining us. We'll stay in touch with you, and I hope you have more updates for us the next time we chat with you. I've been speaking with our foreign affairs correspondent, Amarachi Ubani, and she's been telling us more from Washington, D.C. concerning the first case of the Ebola virus disease in the United States. Thank you. Now to the Middle East. The Islamic State militants are battling